Hey everyone, and welcome to today's Explainer. Whether you're a med student, a nursing student, or honestly just somebody who finds the human body completely fascinating, we've got a great one for you today. We're going to take a really structured visual journey right through the anatomy of head and neck veins. You can really think of the venous system kind of like a gravity-assisted downward flowing drainage network. And our main goal today? Well, we're going to map that entire network out together, step by step. So have you ever actually stopped to think about this? How does blood from your brain and face safely navigate its way back down to your heart? It's a pretty wild thought. Every single time your heart pumps fresh, oxygenated blood all the way up to your brain and face, literally all of that deoxygenated blood has to find a safe route back down to your chest. It has to squeeze through tight spaces, fight against any backflow, and merge into these massive vessels without missing a single beat. And to do that, the head and neck veins form this incredibly complex network. Their whole job, their primary purpose, is to act as this master drainage system, pulling that deoxygenated blood from the tissues of your head and neck, routing it downward, and finally dumping it back into the right atrium of your heart. At first glance, I know it looks like this crazy, chaotic, dense forest of blue rivers, but I promise you there is a very, very clear logic to how this whole thing is laid out. To make this super easy to digest, anatomists actually divide the veins of the head into two main buckets. First up, we've got the intracranial veins. As the name implies, these are found entirely inside the cranial cavity itself, draining the brain through structures like the dural sinuses. Then, on the flip side, we have the extracranial veins. These guys sit outside the skull in your soft tissues, your muscles, and your skin. For today's Explainer, we are going to hyperfocus on those extracranial veins and exactly how they connect to the massive veins waiting down in your neck. Section 1, Scalp and Facial Veins, starting at the top. Okay, let's dive into this. We're going to start at the very top of the head and follow the flow of blood straight downward. So our first major landmark is the superficial temporal vein. If you look at the lateral side of the head, you'll see how it arises from this really vast venous plexus. Check out those frontal and parietal branches collecting blood from the superficial muscles and the skin of the temporal area. From there, they travel downward, picking up even more blood from the external ear and the parotid gland. Then, just above the zygomatic arch, boom, they unite into one common trunk. It is a massive collection zone for the whole side of your head. Now let's swing around to the front of the face. Look right at the inner corner of the eye. That's the medial canthus. See the supratrochlear and supraorbital veins dropping down from the forehead? They unite right at the root of the nose to form the angular vein. And right here is absolutely crucial. As that angular vein descends just below the inferior margin of the bony orbit, it actually changes its name and continues on as the facial vein. It's quite literally the exact same continuous drainage pipe. It just gets a new name depending on the neighborhood it's passing through. Section 2, Deep Veins and Plexuses, below the surface. All right, so we've mapped out the surface level, but what about the stuff hidden beneath the jaw and deep inside those facial muscles? Let's take a look. Now here is where it gets really interesting. And honestly, this is highly relevant if you're going into any kind of clinical or dental setting. You see, not all veins are just simple, straight tubes. Some of them form these dense web-like networks that have some pretty surprising clinical implications. A truly fascinating and honestly critical structure right here is the pterygoid venous plexus. Tucked away in the infratemporal fossa, this huge network of veins sits right between the temporalis and the medial and lateral pterygoid muscles. It forms these comprehensive, widespread connections with the surrounding facial veins. So why does this matter so much? Well, this web can unfortunately act as a major superhighway for transmitting infections from your face deep into your cranial cavity. So what starts as a superficial facial infection can become extremely serious if it manages to navigate its way into this deep plexus. Section 3, the jugular vein system, the main highways. Let's keep making our way downward. All that blood from the face and those deep plexuses, it needs a major highway to get down the neck and back into the chest. When you compare the surface to the deeper structures, the first thing you'll notice are the superficial neck veins. The big standout there is the external jugular vein, which runs just deep to the skin and the platysma muscle, mainly draining the scalp and the face. But if you look deeper, you run into the massive internal jugular vein. This one is positioned way deeper, inside the carotid sheath, right alongside the carotid artery and the vagus nerve. The internal jugular is the absolute largest vein in the neck, and it's doing the heavy lifting, draining almost all the blood from the intracranial cavity, the brain, and those deep facial structures.
Because the internal jugular vein is the main highway, as you'd expect, it has a ton of on-ramps. As it travels down your neck, it receives venous blood from a bunch of tributaries. You don't need to perfectly memorize all of these right this second, but just appreciate the variety here. It collects from the inferior petrosal sinus, the pharyngeal venous plexus at the back of the throat, the common facial vein, the lingual veins draining your tongue, and both the superior and middle thyroid veins. Every drop of this deoxygenated blood feeds directly into this massive central column. Now, with all this blood rushing down this vertical pipe, you might be wondering, what happens when pressure changes in your chest? Or, say, when you simply bend over to tie your shoes? Well, the internal jugular veins have a really cool built-in failsafe. They contain specialized valves located at their distal ends, right before they enter the chest. You can think of these essentially as one-way traffic doors. They securely clamp down to prevent any blood backflow, making absolutely sure that everything is directed safely and efficiently toward the heart.
Section 4, returning to the heart, the final connection. We have finally made it down to the root of the neck. The blood has traveled from the top of the scalp, through the facial veins, down that giant jugular highway, and is now getting ready to re-enter the chest cavity.
Looking really closely at the base of the neck, you'll see the subclavian vein sweeping in from the lateral side. This is a massive deep vein that's taking in all the deoxygenated blood from your arm and your shoulder. Notice exactly how it travels right behind the collarbone and then unites directly with our descending internal jugular vein. This specific junction takes place right behind the sternoclavicular joint. Now, this specific intersection is a highly testable anatomical landmark. But honestly, this part is often misunderstood by beginners. Why? Because this junction isn't just about blood. The exact angle where the internal jugular and the subclavian veins unite is creatively called the venous angle. And it's famous because it serves a secondary, vital purpose. It's the exact drop-off point for your body's lymphatic system. We have two major lymphatic ducts, the thoracic duct over on the left and the right lymphatic duct on the right. Both of them empty their lymph fluid straight into the venous circulation right at these respective left and right venous angles. It is just a fantastic example of the body's different systems working seamlessly together in one compact space. And that brings us to the grand finale of our downward journey. Right after the internal jugular and subclavian veins merge at that venous angle, they form what's called the brachiocephalic vein. Some folks also call it the innominate vein. Naturally, you have a right and a left brachiocephalic vein. Notice how the right one has a fairly short, mostly vertical drop, while the left one is quite a bit longer because it has to cross over. Ultimately, both of these valveless vessels join together in the upper thorax. Their job? To funnel all of that systemic blood directly into the superior vena cava, which then dumps it straight into the right atrium of the heart. Journey complete. Section 5, Summary and Final Takeaways. All right, let's take a step back and see how this all builds together into one cohesive picture. We've covered a ton of anatomical ground today. So here are your absolute core takeaways. First, remember that the head veins are broadly divided into those intracranial and extracranial groups. Second, definitely keep in mind the clinical importance of the pterygoid venous plexus. It is a risky pathway for deep infections. Third, never forget the distinction between the superficial, external jugular vein and that massive, deep internal jugular highway that's busy draining the brain. And finally, lock this into your memory. The venous angle, where the jugular meets the subclavian, is the crucial entry point for your lymphatic system. Understanding this drainage network is absolutely going to give you an incredible foundation for clinical anatomy. If you found this visual breakdown helpful, make sure to hit that subscribe button for more simple, structured medical explanations just like this one. Also, I've got a question for you, and I want you to answer it down in the pinned comment below. What is the most surprising fact you learned about the jugular vein today? Was it the distal valves? Was it the lymphatics connection? Let me know. Keep studying hard, and I'll catch you in the next explainer.